Welcome to the Heart of Giving. I'm Heather Clemens, the marketing consultant for the United Way of the Mark Twain area. This podcast will highlight one of our partner agencies that is making a real difference in the community we all share. We invite you to listen and think about how you can give back, whether it's by volunteering your time or making a donation to support the work happening here at home. As we look ahead to Giving Tuesday, we encourage you to join us for a special event, Charcuterie for Charity, happening Friday, December 2nd from 11 a.m. to 1 p.m. at the Rialto Banquet Hall in downtown Hannibal. Now from the Burt Studio at Hannibal LaGrange University, here is today's conversation featuring one of our partner agencies.
Now, from the Burt Studio at Hannibal LaGrange University, here is today's conversation featuring one of our partner agencies, Hannibal Free Clinic. Let's start by getting to know you. Could you introduce yourself and share how you first got involved at the Hannibal Free Clinic?
Yes, my name is Sharon Webster. I'm a registered nurse. I've been with Hannibal Regional Hospital for 44 years. I was in home health for over 17, and back in 2006, they asked me if I would be interested in helping get the free clinic up on its feet. And I would probably be there for a year and a half to 2 years. And here we are in 2025, 18 years later, and I'm still here. But that's how the free clinic got started and how I got involved.
All right, thank you very much. So, now that we know a little bit about you, could you explain what kinds of services the clinic provides? And what do you think are the services most people in the community don't realize you offer?
Well, the free clinic provides free non-emergency care for adults in a 6-county area here in Northeast Missouri that do not have insurance or Medicare or Medicaid and have a lower income level that they can't afford to purchase insurance. We have volunteer doctors who see the patients or clients in our office, along with the volunteer nurses and office workers. We have a medication program through patient assistance where the expensive medications like inhalers and insulins, we can get them for free for the patients where they definitely could not afford to buy those. We partner with Clarity for mental health services. We also partner with the Lions Club here in town and HQIs for vision care. We help people if they can get a YMCA scholarship to help pay some of their membership fees so that they can have access to exercise programs year-round. We utilize Hannibal Regional Hospital for our labs and things like that. We're developing a partnership with A.T. Still University to help with some dental services at the clinic.
All right, thank you very much. So, to show the real impact of your work, could you share a client's story that highlights the clinic's services matter to people in their community?
There's several that have made a big difference. Just for a couple of them, one person was going to the emergency room 10 or 15 times a year because they were having breathing problems, respiratory issues. By having a primary care physician and access to inhalers and other specialty medications, for the past several years, they've made less than one trip to the ER each year, and they're now able to work full-time. Another person we saw frequently, they had diabetes, and they was very poorly controlled, and we just had to keep increasing their insulin, and they were up to over 100 units of insulin per day. They weren't feeling good. They were having a lot of pain. They worked with a health coach and a pharmacist, and we did education on diet and challenging to them to increase their activity, and we added some new medications. Famous GLP-1s before that was even a thing, and we changed their habits, and they've even participated in some 5Ks. They're no longer taking any insulin, and they're only using that one medication. And they didn't have to they were getting ready to place their mother in a nursing home because they weren't going to be able to take care of her, so they were able to keep her home longer and do that to take care of her. So, both of those people, by having access to care through our clinic, we're able to, become, more productive in life.
All right. So for the next question, for those who want help, how can people in the community support the clinic, whether through volunteering or giving?
Well, everyone at the clinic is a volunteer except for myself, who I am donated through Hannibal Regional Hospital, and my front office manager. Everyone else, the doctors, the nurses, the office support people, they're all volunteers. We could use more people to help us on clinic day, to nurses or someone that can help us room the patients before they see the physician. And we also receive no state, local, or federal funds, and we have to raise all of our own money for everything through fundraisers and donations. And, the building is donated to us, the space is donated from Hannibal Regional Hospital, but we still have utilities, insurance, and then we do help patients a lot with diabetic testing supplies, medications, and things like that. So we do, always accept financial donations to help with those things. We're lucky to be a United Way agency, and we also utilize some local foundations and business grants, but, funds are always welcome.
All right, thank you very much. So, as you know, every organization has ongoing needs. Could you share an important need that the Hannibal Free Clinic currently has and how people can meet it?
Again, like with the volunteers, people to help us on the days when a doctor is there to help us put patients in rooms. If you're interested in that, you could go to hannibalfreeclinic.org and go to how to help and submit an application there. And we also take cash donations through that website. You can do a one-time cash donation, or you could sign up for our monthly Power of 250 program, which helps us explain that just $2.50 a week, which is less than you're going to pay for a cup of coffee. It's $10 a month, and it can help us with the diabetic testing supplies. And we do occasionally help people purchase medications locally if they've started on a new medication or they need an antibiotic and it's just not in their budget. We can help them, use those funds for that.
All right, sounds good. So, I want to go back to something from earlier. We mentioned Giving Tuesday. So could you help us a little more, tell us a little more about Charcuterie for Charity happening on December 2nd and how people can be part of that?
We will be partnering with a local business. I'm not exactly sure which one yet. And we will be having a charcuterie selection of probably barbecue items, kind of what we've always done for our fundraisers. We used to have a rib event, and now we have a bourbon and barbecue event. So we kind of always do barbecue stuff. And we invite everyone to join us at the Rialto from 11 to 1 on that day. We're going to have barbecue. There'll be a lot of other types of food. And if you could make a donation to us that week, anytime that week through the United Way, those funds are being matched. Dollar for dollar, which will be great help.
All right, so next up, if someone listening wants to get connected or learn more, where can they go? Like a website, a phone number, or social media?
So our website is hannibalfreeclinic.org. You can call us on the phone at 573-248-8307. We are on Facebook, Hannibal Free Clinic. You can stop by the clinic at 160 Progress Road, or you can also send us a message through Facebook Messenger.
All right, so before we wrap up, is there anything else you'd like to add that we haven't covered?
Well, I want to thank you for the opportunity to share information about the Hannibal Free Clinic. Please reach out if you have any questions. And most importantly, if you know someone who is in need of some services for healthcare, please reach out to us or give them our contact information. It's amazing that even after 18 years, how many people in Hannibal and in the surrounding area do not know that there is a free clinic and what we can do to help you.
All right, well, thank you for your time. That'll be all. Thank you.
Thank you.
Thank you for tuning in to The Heart of Giving. We hope you've been encouraged to take part in building a stronger community. For more information about our partner agencies or to get involved, visit unitedwaymta.org. Until next time, I'm Heather Clemens. Thank you for listening and for being a part of the Heart of Giving.